The Sam and Rose Stein Institute for Research on Aging is committed to advancing lifelong health and well-being through research, professional training, patient care, and community service. As a nonprofit organization at the University of California, San Diego School of Medicine, our research and educational outreach activities are made possible by the generosity of private donors. It is our vision that successful aging will be an achievable goal for everyone. To learn more, please visit our website at aging.ucsd.edu.
So this is the first slide which she really shared with you all the titles I have the honor of having, and the title of the talk as well. So this effort really stemmed, I'm going to say began in the rest of the world where they spell aging differently than we do here in the US. So you'll see different spellings of aging throughout the presentation. So this is what I'll be discussing today. The main topics are: who's interested in global healthy aging and why does it matter? What is the World Health Organization or WHO definition of healthy aging? What is the UN? We'll spend much of the time talking about this UN Decade of Healthy Aging initiative. We'll spend a minute talking about the Age Well San Diego initiative. And we'll have 5 different polls scattered throughout. These are opportunities for you to answer questions that I have, multiple choice questions that I like just to make it a little more interactive, and we'll go over the answers. All of this, of course, is anonymous. So why does global healthy aging matter? So the world is very interested in this topic. Many organizations and companies are interested in this. It's because population aging is one of the most significant social transformations of the 21st century. And it has implications for, I'm going to say, all sectors of society, including health, labor, financial markets, demands for goods and services, and also has great implications for family structures and intergenerational ties. This, I put up this slide because it refers to a publication that came out in 2017 by the National Institute on Aging, which is excellent and provided me an introduction to this topic. As I said, companies are interested in this topic, so including pharmaceutical companies. So here's just a couple of examples of companies that have made healthy aging one of the areas of focus. And here, before I begin some more with facts, this is a publication by the National Academy of Medicine, and it's called Global Roadmap for Healthy Longevity. So this is a pretty new publication, and it reviews international efforts. It is an international effort, you'll see on the slide here, to achieve healthy longevity, which they define as the state in which years in good health approach the biological lifespan, with physical, cognitive, and social functioning, therefore enabling well-being across populations. So this is a theme you'll see repeated regularly throughout this talk. And the principles for achieving healthy longevity is the summary of this roadmap is that 1, people of all ages, particularly older adults, reach their full potential to live life with good health, function, meaning, purpose, and dignity. 2, that societies enable the best health and functioning that individuals at all ages are capable of attaining. 3, societies reduce disparities and enhance equity within and among countries to realize the well-being and contributions of all people, including those of older ages. 4, the human, financial, and social capital of older people is realized for the benefit of all society. And 5, societies use data and meaningful metrics to track the achievement of outcomes and guide decision-making. So with that, lofty introduction of what these initiatives are, or the theme of this talk, we'll go into some data now. So these are population pyramids. A population pyramid, for those of you not familiar with this, is a graphical representation of the distribution of the population by sex and age group. So in this diagram here, I have the world population in different times. So top left is 1950, top right is 1990, bottom is 2020 on the left, and bottom right is 2050, which is predicted. And so you can see here, and yellow is it depicts female gender, blue male gender, and the lowest part of the pyramid is the number of younger people, and then the highest part of the pyramid is older adults. So where it gets a little darker in color, that's where you see is 65 and up. And the breadth of the pyramid is really the population number in the world. So you can see in 1950 really looks like a pyramid. It was narrow, it was a smaller size population, roughly, gender equivalence between men and women that sort of persists. And we see here that relative to the younger population, there's quite, many smaller older adults. And you can also see that over time, the shape of the pyramid is shifting to more of like a dome, a pointy dome over time, which gets accentuated, to 2050. And so to give you some, numbers here, in 1950, there was no single country that had more than 11% of its population age 65 and older. But in 2050, it's estimated that countries who have the highest proportion of older adults will have up to 38% of their country's population be age 65 and older. So to get into a little more detail with this is a graphical representation of the percentage of the population in the world who will be age 65 and older at various, times. So you can see in 1950, it's, pretty low, and then it gradually climbs. We're here in 2020-ish, and then it, gets even more serious slope over time. So a faster growing proportion of the population age 65 and older. So in 2020, there was an estimated 727 million persons age 65 and older worldwide. And by 2050, this number is predicted to more than double, reaching over 1.5 billion persons age 65 and older. The share of older persons in the global population is expected to increase from 9.3% in 2020 to 16% in 2050, which is 1 in 6 persons. So globally, the population age 65 and older is growing faster than all other age groups. So this is large part of the reason why the world cares about aging populations. So what are the demographic drivers of population aging? To put it simply, it's fertility, mortality, and migration. One of the bigger contributors to this then is the fertility. So fertility is declining globally. This means there's fewer people in younger age groups, so leading in more age groups having older, bigger numbers, and so an older population. Also, mortality is improving, so increased survival, or mortality is decreasing. Increased survival means, again, more people living longer, so more people in older age groups. And a smaller contributor to this worldwide, but certainly has major impact in individual countries, is migration. So international migration, people who are younger tend to be migrants. So if you move into a country, you're going to typically be a younger person, and that can slow population aging in the country that receives the migrants. And this can be perhaps just a temporary change, but it can reduce that overall age group of the country people are immigrating into. So next, we're going to our first poll. The question is, which of these countries has the largest percentage of people age 65 years and older? So choose one: Greece, Spain, or Japan.
Okay, so we have 86% for Japan,
Okay,
5% for Spain, and 9% for Greece.
All right, we got a very educated audience. Okay, so you're correct. The answer is Japan is number one. Japan has been number one for a while. It has the biggest proportion of older adults in its population. This is followed by, in this list, Greece and then Spain. To give you a little more data, So Japan's number one. Number two is Italy with 23%. So Japan's, is quite a bit more than Italy. And then there's a three-way tie between Greece, Finland, and Portugal, all at 22%. And Spain is number three. And just to put in context, the United States has 16% of its population in 2020, age 65 and older. All right. So this is a depiction of the another way to look at global aging. And so here you can see different colors on these maps. And so the populations with the highest percentage of older adults are more in the green aqua color. And then populations with lower percentages become more yellow. And so you can see it's quite heterogeneous among different countries, the proportion of older adults. It's really in some ways quite remarkable. So global aging is something of concern and also wonderment for us because with more older adults, we have more wisdoms and we have more, wonderful characteristics of older adults and all they contribute to society. And some of the negative challenges of aging, which many of us experience, is that there's more disability, there's more disease, and potentially more need for caregiving. So these are some of the challenges of global aging. There are many, many wonderful opportunities, but there's also many challenges. It's also notable that related to the demographics again, low and middle income countries are now they have a smaller proportion of the population. So, much of Africa, India, even China, they have a lower proportion of older adults, but they have the biggest number of older adults. So as these countries evolve, they're going to be the drivers of population aging. All right. So moving on to this idea of healthy aging and initiatives. So healthy aging was the focus of the World Health Organization's work on aging between 2015 and 2020. It still is, but this was one aspect of it, or one version of it. It emphasized the need for action across multiple sectors, as well as enabling older people to remain a resource to their families, communities, and economies. It had this wonderful infographic you could get as a poster. I still love this infographic. So they started this work again in 2015. So their definition of aging is a little different than the one I shared earlier from the National Academies of Medicine. And they defined healthy aging as the process of developing and maintaining the functional ability that enables well-being in older age. And functional ability is about having the capabilities that enable all people to be and do what they reason to value. So this includes a person's ability to meet their basic needs, so self-care needs, to learn, grow, and make decisions. For example, some of that relates to your cognitive capacity, to be mobile, so to get around as you need to, either on your own or with some help from like an assistive device such as a cane, to build and maintain relationships, so really maintain social connectivity, and to contribute to society in all the ways that older people do. So some examples are through working, volunteering, other wonderful ways. So functional ability, how is this defined? As a geriatrician, I view it as, what you can do for yourself. Can you do your self-care activities? Can you do the activities in the, in the community you need to do? And do you do other activities that are really, for the value to yourself and society? But in this way, they talk about functional abilities made up of your intrinsic capacity of the individual and the relevant environmental characteristics, as well as the interaction between them. So intrinsic capacity is, all the capacities that you have mentally, physically, including your ability to walk, think, hear, see, and it's influenced often by disease, injury, and age-related change. Environments include your home, your community, broader society. And so it involves things like the built environment. So are you able to get around because the environment enhances that? Are there good sidewalks for you to take walks on? Is there green space for you to play in? Also social policies and systems that impact your ability to do things and live well. So all this is related to your functional ability. And then key considerations in healthy aging are that diversity and inequity. So there's no typical older person. That's one of the reasons I love geriatric medicine so much, is that it is so heterogeneous. So some older people, 70, 80, 90, have very high levels of physical and cognitive or mental capacity that compare favorably with many younger people, like 30-year-olds. And other 80, 90-year-olds that need much more support for basic activities like eating and dressing. So it's quite variable. Inequity. So a large proportion of the diversity in capacity and circumstances observed in older people is a result of the cumulative impact of advantage and disadvantage across people's lives. So the relationships we have with our environments are shaped by factors such as the family we were born into, our sex, our race, ethnicity, level of education, financial resources, and more. So healthy aging, again, is about creating environments and opportunities that enable people to be and do what they value throughout their lives. And I highlighted this to really make the point that everybody can experience healthy aging. Being free of disease or any kind of infirmity is not a requirement for healthy aging. Many people live with conditions that have no influence or little influence on their well-being. So it is not the absence of disease. It is really a unique attribute that everyone has or can have. So moving on to the next part, this is really, want to talk about the UN Decade for Healthy Aging, which built on the prior work that went from 2015 to 2020. Now we're moving into 2021 through 30. So the Decade of Healthy Aging is a global collaboration that brings together government, civil society. You see all the list. It's like everything is brought together as much as possible to engage in 10 years of concerted, catalytic, and collaborative action to improve the lives of older people, their families, and the communities in which they live. So it has 4 action areas, and they are first to ensure that communities foster the abilities of older people, that they change how we think, feel, and act towards age and aging. We deliver person-centered integrated care and primary health services responsive to older people, and provide access to long-term care for older people who need it. So these are where they want to go and are working on. So let's talk about the first one. It's simply named age-friendly environments. And so you can see here that we've sort of talked about this a bit already. So health and well-being are influenced by the physical and social environments in which we live. Environments help determine our physical and mental capacity across our lives, and also how well we adjust to loss of function and other forms of adversity over our lives. Both older people and the environments in which they live are diverse, dynamic, and changing, and the interaction of both may enable or constrain healthy aging. So part of this is addressing social determinants of healthy aging, such as improving access to lifelong learning, removing barriers to retaining and hiring older workers, providing adequate pensions, social assistance, and reducing inequity. So far, the work of the UN Decade has included a creation of a global network for age-friendly cities and communities, and developing a mentoring program to enable people to do this work, and a wonderful database of age-friendly practices, which again is global. So for example, some of the age-friendly environment work has included improving bicycle safety in places where all ages use bicycles to get around as their primary source of transportation. Another example is a program that for people age 75 and older, it provides free handyman services for their home. So pretty neat stuff they're working on. Okay, next we're going to do our the next poll, which is which of the following are examples of age-friendly environments? You can pick multiple, so it's yes or no for each of them. So I can read it too. It's an emergency department that asks caregivers to wait outside to prevent crowding, bus drivers who are able to assist those with mobility limitations, intergenerational social events during the evening that require private transportation, public housing with narrow hallways and dim lighting, pedestrian crossing indicators that announce when it's safe to cross and allow enough time for mobility impaired persons to cross safely, and providing information in print and broadcast media, as well as through social media and online sources. So you can pick as many as you want. relatively few picked number one. That's true. Leaving the caregivers outside is good for preventing crowding, but not really great for care of the older adult in there. Bus drivers assisting, that was answered by 93%. Terrific, yes. Intergenerational social events, of course, is wonderful, but having them at night and requiring your own car to get there is not so wonderful. So 29% chose that. Public housing, narrow hallways, dim lighting, again, might be difficult to get through the hallway depending on your mobility issue. Dim lighting is bad for everybody. So only 4% picked that. Pedestrian crossing indicators that announce when it's safe to cross, allow sufficient time. That's a good thing. 90% picked that. And providing information in various formats for people to access is also good. 80% picked that. Thank you. All right. So the next topic is combating ageism. So ageism is stereotyping of, which is really how we think, is stereotyping. Prejudice against, that's how we feel, and discrimination towards, how we act, people. So ageism is the stereotyping, prejudice against, and discrimination towards people because of their age. Ageism affects people of all ages, but has particularly deleterious effects on older people. So this is getting a lot of traction, thank goodness. So ageism is highly prevalent. However, unlike other forms of discrimination, including sexism and racism, it is socially accepted and usually unchallenged because it is largely implicit and subconscious in nature. Children as young as 4 are aware of their culture's age stereotypes. These stereotypes focus predominantly on the negative aspects of aging, with older age typecast as an inevitable decline in physical and mental capacities and a period of dependency. Language and media, including film, television, popular music, print, social media, most often echo and reinforce these stereotypes because ageist depictions tend to be the norm. And as we get older, we experience ageism from others, but also from ourselves, because of the unconscious internalization of society's negative attitudes and stereotypes towards older people. This helps to explain why older people, often try to, quote unquote, stay young and feel shame about getting older and limit what they think they can do instead of taking pride in the accomplishment of aging. So ageism has been shown to have a significant impact on older adults' participation in society and on their health and on their longevity. So one study looked at this, or many have, but this particular study I'm citing found that those who held negative attitudes on aging had a slower recovery from disability. They live on average 7.5 years less than those who hold positive attitudes and are less likely to be socially integrated. So ageism is bad. It also imposes barriers to the development of good policies on aging and health, as it influences the way problems are framed, the questions that are asked, and the solutions that are offered. And in this context, age is often understood as a sufficient justification for treating people unequally and limiting their opportunities for meaningful contribution. So next poll, what are some of the ways you have experienced or observed ageism? You can select as many as you want. Here's the answers. They're all examples of ageism. So even the sweetie one, believe it or not. So negative statements about older people, that's of course ageism. Products that are designed without regard for changes that occur with aging, this is incredibly predominant. Anything that's called anti-aging, that's prevent what we are and so amazing that we can be aging. Being called sweetie is also a version of ageism, a little less obvious. Saying you look good for your age, and then assuming older people don't have sex or can't use technologies and other examples. Most of you picked all of these, with the minority being called sweetie, 38%, and anything anti-aging, 52%. All right. So the third focus of this effort is improving integration of health services. And so older people require, we all do, in fact, non-discriminatory access to good quality essential health services that include really a wide range of services. So prevention, promotion, curative, rehabilitative, palliative, and end-of-life care. safe, affordable, effective, good quality, essential medicines and vaccines, and dental care and health and assistive technologies, and all at a price that is feasible. So this could be, something that none of us have seen, but it is a goal. So let's get into the and what I've noticed in healthcare, you probably have too, is that many health systems, including our own in the U.S., is set up really to take care of acute conditions, and individual conditions, but is less good at addressing issues that are common with aging, that are relate to each other, age conditions or age associated conditions that come together and need to be managed together. So problems with heart and kidney and vision and hearing. So addressing all those things often in working to address them well together, not as separate entities. Primary care, strengthening primary care is a focus of this work. And there are many examples. Again, I'll show you some more information on this and how to see what the UN is doing in this regard. So this is the fourth poll. So which of the following are ways to address health service and systems meeting older adults' needs? So which are the ways that we can improve these things? And you can choose multiple again. All right, here are the answers. So only one, almost, no one chose the first. So limiting is kind of a cue. Access to hearing aids and dental care is not a great way. Telemedicine visits with technical support. So note the technical support is a good thing. Colon cancer screening for everyone. 79% of you chose that one. That's actually not a recommendation. So it's because you need a lead time of at least 10 years for colon cancer screening to be useful. And so if you reach 90, then colon cancer screening is not really going to be useful because most people aren't going to live to 100, and there's definitely some risk to getting colon cancer screening, which usually occurs via colonoscopy. So the recommendation is to quit at age 75 for screening. If you already have something they found like a polyp and you need additional screening later and you're in good shape, yes, keep it going. It's more of a surveillance as opposed to screening function at that point. I'll be offered. So the rest of you really got these last two too. But these last two are also part of good care for older people. All right. So the last of the areas that they're working on is long-term care. Declines in function can limit older people's ability to care for themselves and to participate in society. Access to rehabilitation, assistive technologies, and supportive, inclusive environments can help. But even so, some of us will get to the place where we can no longer care for ourselves without support and assistance. So access to good quality long-term care is essential to maintain function, enjoy basic human rights, and to live with dignity. So one of the things that needs to be done to support this goal is to increase the capacity of informal caregiving. And some of the other activities that the UN Decade for Healthy Aging is engaging is providing technical support for an analysis of different countries so they can figure out what they have for long-term care and what they need to provide. And they're designing tools and guidance for good packages of long-term care as part of universal health coverage, providing online resources for informal caregivers, and other activities to really improve this. Okay, so our last poll. Which of the following are ways to address access to long-term care or to improve it? So these are the answers. So the minority of you picked the first one, which is expand fee-for-service care. Although it does have virtues, it's a truth, it's not great for long-term care because it's really long-term care is not included in fee-for-service care typically. But other things that can help address the access to long-term care is to help professionals understand what long-term care settings can be and what long-term care support can look like. And then another thing that can help is to facilitate communication between primary care doctors, specialty care of all types, primary care of all types, and long-term care systems. So it can be difficult to communicate between systems, and that is a barrier to care. So now the way it works is you can be connected, for example, with your primary care and the specialist, and the same health system can be connected, but long-term care, like I'm talking nursing home care in this context, there's zero connection between that. So it just makes it difficult. All right. So to support this work in the UN Decade for Healthy Aging, they have come up with what they call decade enablers. So these are things to help make this all happen. So they have 4 different versions of that, or levels of that. And first is voice and engagement. So as part of this platform, which you can all access if you can just look up UN Decade of Healthy Aging, I have a link in this bottom of the slide here, is in having people connect directly with them. So having people tell their stories, provide information, support each other. One of the examples they have is they have an initiative called the Healthy Aging 50, which includes the stories and work of 50 leaders transforming the world to be a better place to grow older, is what they have on their site. Next one is leadership and capacity building. So really help improve governance, to develop appropriate laws, policies, financial resources, and to support stakeholders to develop competencies. So if you go to this part of the website, they have toolkits to do all of these things and other resources for anyone to access. Next is connecting stakeholders, so across sectors and disciplines, to leverage resources, share learning and experience, and act. And then finally, strengthening research, data, and innovation to help inform and drive action to foster healthy aging. Again, many resources on this site to help make all of this work. All right, so I want to spend just this slide on our local initiative here in San Diego called Age Well San Diego. So it was developed at the direction of the San Diego County Board of Supervisors in 2016. The county applied to join the World Health Organization and AARP's network of age-friendly communities, and it became also a dementia-friendly America community partner. So Age Well San Diego is the marriage of these two things. In San Diego County, age-friendly and dementia-friendly equals Age Well San Diego. So they have 4 different or 5 different, areas. So first is health and community support. This encourages the development of community support systems. So I don't know if you've heard of the village model. It's a model which communities are more formally engaged to help each other. Also, for the number 2 is housing. Housing is one example is implementing zoning and design requirements that create accessible mixed use communities that have a variety of housing types and services. The third is social participation, so to create policies that facilitate, in this case, intergenerational engagement. For transportation, one of the ideas they have are working on is developing a coordinated, innovative rideshare mobility system for all users. And by dementia friendly, they incorporate all the elements in the other 4. So to a dementia friendly community, to define it, is one in which people are aware of and understand dementia, so that people with dementia can continue to live in the community they choose and in the way they want to. And also to support this effort, recently, I think it's going to be in the paper in the next day or 2, the county has appointed its first ever geriatric health officer to support these activities. So that is a wonderful thing. And yeah, I'm very happy about that. Okay, so takeaways from this talk. The world's population is aging. Healthy aging can be defined as maintaining function to enable well-being in older age. The UN Decade for Healthy Aging is a global effort intended to improve the lives of older people, their families, and communities. And the platform related to that is a means of connecting and informing stakeholders to achieve the goals of the UN Decade for Healthy Aging. And Age Well San Diego is our local version of this work that is on its way. All right. So I just want to end by thanking you so very much for being here today. I look forward to taking your questions. Global Aging is a wonderful opportunity for us to do good works and celebrate aging people. Thank you.
Thank you so much, Dr. Moore, for such a fantastic talk. I thoroughly enjoyed it, and I know the attendees did as well. And we have some questions. I really loved how at the beginning of your talk, you talked about how healthy aging is not about the absence of disease or disability. I think that's such an important piece for people to remember. I'm curious for you as a clinician, what do you recommend to your patients in order to stay as healthy as they can?
So there are a lot of things, and the audience could inform this further. I know you could, but what I'd like to say is that it's important to stay physically, cognitively, and socially engaged. Use it or lose it is a truth. And so it is really important to stay socially connected, to be physically active, and to use your brain. That's kind of the big things I say. In addition to this, other health related stuff, do your preventive health stuff, take your medications if they're, if you need any, that kind of thing. But the big three is just use it, use it or lose it.
That's great. Thank you so much. I experience that all the time. I believe in that as well. Okay, so question from the audience it goes back to the first poll, Dr. Moore. Why does Japan have the highest number of people over 65?
Good question. I'm not sure I know the exact answer to that. I think it must have to do with, again, the issue with fertility and mortality. So again, I don't know the exact answer, but I can imagine it's because they had a potentially lower fertility, smaller population growth over time, and that's why it's aged more quickly than some of the other countries.
Okay, so here's another question that I don't know you'll know the answer to, but we'll try. Do you know what the percent of people is that have experienced discrimination, age discrimination? That statistic.
Everybody, I think 100%. If you look at the examples of ageism, and we do self-ageism. So it's everywhere. I think it's 100%.
Yeah, okay. This is a question about colon cancer screening. There's a comment and a question. Colon cancer screening can be done by using the FIT test, which is simple and done by patients at home and carries absolutely no risk. Would you support that in folks past 75? Now, I'm not familiar with what the FIT test is. Maybe we have to clarify that as well.
I know what that is. It's we call it FOBT. It's fecal occult blood test. That's the one I think that they're referring to. And it's where you take some of your stool and put it on a card and they test it for blood. So the thing about that, though, is if it's positive, that means it has blood in it. You're still in a setup, you still need a colonoscopy, and that definitely has risk associated with it. So no form of colon cancer screening is recommended, really for, again, screening, not surveillance. That's the official recommendation, 75 and up, based on evidence. No benefit after that time.
Okay, thank you. Here's another question. I believe you mentioned a mentorship program connected to the UN initiative. Can you expand on this, please?
So I'd have to read more about it, and I do encourage you to go to the UN Decade for Healthy Aging website, where there's an unbelievable amount of material. What this website provides is a toolkit, a community, tons of information. So one of the ideas or things that they're working on is this mentorship program.
Okay, here is a question that I know is very near and dear to your heart, Dr. Moore. How would you like to see geriatric medicine incorporated into medical education in order to improve care for older adults in future years?
So yes, thank you for that question. So I think that it's been a shame, I'm going to say, in my career that over time there haven't been more people that go into geriatrics specifically. There's a lot of reasons for that. But every single doctor will care for older people. And they're not going to be geriatricians because they're just like, there's 7,000 of us. So what we want to do in medical education is make the students aware of the, the important things that we see with older adults, that they are, again, many of the things we've talked about in this talk, having a number of illnesses does not make you, impaired necessarily. Thinking about illnesses as a holistic approach to caring for someone is super important. You can't just say, okay, I'm going to treat the diabetes in this way and the heart disease in this way and the kidney disease in this way. And so really thinking about an integrated approach and holistic approach to caring for the person is necessary. And I think having positive role models for both aging, which we do see all the time in healthcare, and positive in terms of both the patients and the providers. So providers need to be, I would say it gets difficult when you're stressed and busy, and older adults aren't, I love it, but they tend not to have like one problem or no problems. They have multiple problems, and that can be overwhelming for some people, and that can then turn into so having positive role models for taking care of older people, and being really, it's bad to say, I tell people, my patients, you never want to be interesting to a doctor, but doctors like interesting stuff. And so older people often have interesting stuff. So sort of bringing the positive back to it. What is positive about caring for older people, interacting with older people, or role models?
I think that's great. It's like the focus that our center has been, which is on the things that go right with aging, and how we can enhance those things.
Right. And take care of the things that don't go right. But, also, I tell people how you age is often how you manage. So there's all this stuff gets better with age, wisdom, your experience and all that. But there's stuff that happens to all of us. Like you get, muscle aches and pains, you get some conditions that start. I have hearing loss, I've got, osteoarthritis, but it's how you handle it. I think that sometimes I see as the difference between, aging in a way that's, healthy and aging in ways that are less healthy.
Yes. It's one of the reasons why we developed an intervention to help enhance resilience, right? Our ability to adapt to adversity, contributes to longevity as well.
Yes, very, very true.
So we have a question, Dr. Moore, on people with serious mental illnesses and the impact that might have on them aging well.
So, it's again, if you don't have, I think it's again this idea of intrinsic and extrinsic, so or environment and intrinsic capacity. So you may have internal, troubles with physical and or mental health, and it's in part how you're supported in community, society, your home that can determine how well you do, and in part it's how well you personally can manage too. So serious mental illness is a challenge, and it's like many illnesses going to have ups and downs often with how people are doing. And I think it's a combination of things that can make people do well or not, which as I said is both what the person can do for themselves and what their support system can do, and do they have a support system.
Okay, great. So this is actually a really fantastic comment, which I'll read. More a comment than a question. I fall into the aging category, but have not really experienced ageism. I often spend time with others in my age group, and we share many laughs about the aging process that we're experiencing. So, a positive anecdote.
Good. Yes.
On that. Okay, so this is a question on nutrition education and how it affects disease.
Okay. So that's a question.
Yes.
Okay.
Somebody's asked about nutrition education and how it affects disease. It's a little general, but I think you could probably speak to this.
So nutrition hasn't been something I'm going to say is traditionally a strong component of medical education. It's probably changing now than it was certainly when I went to medical school. We are, taught, we're still, to be frank, very focused on, okay, what medication can we use? What, education intervention can we provide? Yes, nutrition's important. I can give you some basic tips. But if you need like serious, serious information, then I'm going to send you to somebody else typically, right? Or send you to some resources. So, so nutrition is, of course, extremely important for our health. in terms of, not only what types of foods we eat and how much we eat, but so it's probably a bigger part of education than when I last, experienced it myself. So again, an important thing. There's so many important things in education now. And I think it's, again, so much education is also not just in the medical space, right? It's public health and it's policies. So, when they started, if was a restaurant chain of a certain size, you had to start putting the calorie count and the, food labels and different things. And so it's really I'm going to say so much of health is more than just that, it's really outside the context of the medical space. It's really a much bigger space.
Okay, thank you. And we just have time for a few more questions. At what age would you stop colonoscopies being done for surveillance?
So most of the time, if you're going to get a surveillance, they say 5 years, rarely 3 years. It's mostly 5 years. So I'd say if your life expectancy doesn't look like it's going to exceed 5 years, I would not do it anymore. And there's a lot of ways to calculate life expectancy. There's something called eprognosis.com that can help with that. So it's really it's sort of if your life expectancy is less than 5 years, no.
And then our final question, which I think speaks to so many of us on this Zoom today, how can we have an impact on this field?
I would say by doing what you're doing, showing up and learning and engaging in all kinds of ways to promote healthy aging, in yourselves, in your communities, in your families. And sort of the mantra of this talk is that it's an effort that everyone can be part of and ideally should be part of. And if you go to the website, you'll see examples from other countries too, as I've mentioned, a couple quite remarkable, and they have all these online communities. So nowadays, whether online you're all online, so you're doing it. It's a worldwide community now more than ever because of our ability to connect in so many different ways. But starting at your self level, local level, and then you can go. This talk has international.
That's great. Well, thank you so much, Dr. Moore, for such an informative talk. I want to thank all of you for attending our event tonight. And with that, we hope to see you all as we launch our new lecture series at the beginning of 2023. Until then, take good care of yourself, and we look forward to seeing you next year. Thank you, everyone.